Maternal health disparities among the Hmong and Bambara peoples.
Maternal health encompasses the health of women during pregnancy, childbirth, and the postpartum period, including quality obstetrical care and family planning.
It is an important topic because it is both a primary healthcare element and a Millennium Development Goal.
The Hmong mountain people are an indigenous group who, by fighting or fleeing, have continually resisted pressures from the Chinese people to assimilate. In 1975, their country fell to communist forces, and many Hmong refugees were forced to flee Laos.
A 2015 census declared that around 300,000 Hmong people currently reside in the U.S.
The Bambara are the largest of many indigenous groups located in Mali, Africa. The term Bambara means the one who refused submission.
In the past, both Muslim groups and the French have attempted to overthrow the Bambara. Nowadays, the Bambara are primarily Muslim, and their lifestyle revolves around farming, which is similar to the Hmong people.
Mali is among the top 10 countries in which women face the highest risk of death during pregnancy and childbirth. Although Hmong women have fewer complications in terms of maternal mortality, their traditional beliefs have a significant impact on their ability to access and commit to healthy maternal health practices.
Both the Hmong and Bambara women marry in their teens, extending the period in which they can have children. Being married young is a primary cause of early pregnancy, poverty, poor education, and low contraception use.
In regards to contraception use, the Hmong are highly suspicious of birth control, and there's also very low use of it in the Bambara population.
Family planning is a major concern between both the Hmong and Bambara. These high fertility rates put women at more of a risk for death related to pregnancy and childbirth. This is a challenge because in both the traditional Hmong and Bambara views, more children means more workers for agricultural work purposes.
Another dilemma is that the Hmong and Bambara women rarely make their own decisions regarding healthcare. The men make these decisions.
The Hmong believe in a very primitive healthcare system and typically avoid prenatal care until the second trimester.
The Bambara women, on the other hand, live in rural areas where they are 9 times more prone to not having prenatal care and 4 times more prone to home deliveries compared to urban women. This prevents them from having adequate monitoring and care during their pregnancies.
The Bambara women are not opposed to accessing maternal health services if available. However, there are barriers to accessibility. These include safety, due to current rivalries between ethnic groups in Mali, and transportation issues.
Many issues with Hmong maternal health are related to their strong advocacy for cultural traditions. The Hmong believe in the use of spiritual rituals, such as sacrificing animals and using medicinal plants. Therefore, they are less likely to access reproductive health services, which results in higher rates of maternal mortality. Hmong women are not comfortable talking about sex and childbearing, and are afraid of invasive procedures.
Now it is important to ask the question, so what has been done to help these oppressed women?
There are many organizations who are attempting to raise awareness about maternal health within the Hmong and Bambara population. There are also several policies that have been created to increase access to maternal services within Mali.
Despite policy development efforts, maternal health is still a concern. Policies created to support maternal health are typically unsuccessful. Our Western perspective on maternal health has notable flaws. Our services can often be confusing and incompatible with their beliefs about health. Crucial factors such as culture, funding, education, accessibility, and transportation have not been considered.
From a nursing perspective, policy development for maternal health should focus on education for local women. Based on other efforts to send trained personnel to teach local students in healthcare, our policy recommendation is for local Bambara to be trained in midwifery skills. This will assist in respecting a local culture while also increasing knowledge, changing behavior, and promoting access to maternal health services. An increase in education will foster autonomy and allow the community to be more comfortable with Western medicine procedures.
Both the Hmong and Bambara people have faced efforts of assimilation throughout history. Their stubbornness in standing up for what they believe is vital in tackling the issue of maternal health.
By receiving valuable education on prenatal care, midwifery skills, and family planning, along with consideration for the low literacy rate and cultural beliefs, maternal health can be changed for the better.
We acknowledge that change will not occur overnight, but by increasing community involvement to implement change, we believe a solution will arise more quickly.